Hello and welcome to another episode of the Healthy Heart Show. I'm Dr. Jack Wolfson, cardiologist, and today I'm so happy to have my good friend Evan Brand on the podcast. If you don't know Evan Brand, you should check out his website, evanbrand.com, and there he's got just tons of information, how to actually meet with Evan and schedule an appointment, which I think it would be of total value for anybody out there. You've heard me do podcasts and talk about health coaches and nutritionists and all these other people that really are dialed into the health and wellness space that'll give you so much more information and value. Cardiologist and your general internist, you go to someone like Evan Brand, and Evan will tell us his story, but I know that he kind of recovered himself several times over from illness. But check him out, and also, of course, his podcast. He's interviewed the best of the best on the podcast, including yours truly, Dr. Jack Wolfson. I think, Evan, you interviewed me, I think, twice maybe, if I'm not mistaken. But in any case, it's great to speak with you. What's happening? What's going on with Evan Brand?
Hey, great to speak with you too. It's always a blast. Not too much is going on. My wife is pregnant with our second baby, so that's pretty exciting. We've got one girl. She's 2 years old. I'm hoping for another girl, but I'll take a boy. I'll take whatever we get. So that's what's cooking in our world, and that's about it. I'm just staying busy with the functional medicine hustle. I work virtually, which is cool because I don't have to travel. So it's good for my clients and it's good for me because I can just jump on a Skype call or a FaceTime call and review labs with people and then make a protocol and ship them whatever herbs they need to anywhere in the world. So I'm kind of lucky and very blessed. And what I've been doing this summer, at least, kind of my new rabbit hole with the whole functional medicine health thing is really focusing on a lot of dental health issues because I found out that I had cavitations. You and I were kind of talking about that off air, and I discovered that I was having some heart palpitations, and I had reached out to you maybe a year ago. I said, hey, Jack, what do you think's going on? I've got these heart palpitations. And you were like, Evan, did you get anything new? And I had just got a new mattress. So that thing was making me sick. So I got rid of that. I got an organic wool mattress that spent a lot of money on it. And then my heart palpitations went away. And then they came back again. And I thought, well, what the heck is this? So, as all of us do in the health field, we reach out to our healthcare friends and say, hey, what the heck do you think this is? And if you ask 10 of your friends that are pretty smart, you're going to get 10 different answers. And one of the answers was, hey, have you had your wisdom teeth removed? And I was like, yeah, I have. And actually, I've had my 12-year molars removed as well. And a friend of mine, Dr. Christine Schaffner, she said, well, you might have cavitations. Why don't you go to this dentist down in Texas and see if he can help you out? So I sent over the x-ray, and he said with 95% certainty that he thought I had cavitations. So I canceled a week's worth of clients and flew down to Texas and paid $5,000 and got the procedure done. And sure enough, that night after I got that cavitation extraction, let me just back up a bit. What is a cavitation? Most surgeons don't remove the periodontal ligament, or some call it the periodontal membrane, when they remove a tooth. This could happen for root canal teeth too, folks. So even if you have wisdom teeth, but you got other teeth removed, that membrane or ligament could still be in there. It basically rots and putrefies. You get sewed up and stitched up, but the infection stays in the gum and it releases toxins into the system, which in Dr. Wolfson's case as a cardiologist, he may have a patient come in with a heart symptom that could be related to the mouth. Now, my bias is the gut because I focus so heavily on gut issues. So I'm sure we can talk about that today and how that could affect the heart too. But just on the teeth rabbit hole for a minute, that night after I got those cavitations cleaned out, I was on an IV vitamin C drip that day. That was the first night I didn't have heart palpitations for probably 6 months to a year. I mean, it was such significant relief that I couldn't believe it. So whenever you find something that significant in a health journey, my health journey is, I guess, never ending. Now it's like I'm asking everybody, did you get your wisdom teeth removed? You might have cavitations. I mean, it's kind of one of those things like, I know with your wife as being a doctor of chiropractic, she probably looks at somebody and is like, oh, that person's got to misalign this or that. Like she probably spots stuff from a mile away. That's kind of how I am now with teeth. I'm like, oh, look at this person. They had this done. They probably got this. So long story short, if you have had teeth removed, you possibly, if you listen to the surgeon, I interviewed my surgeon. He's on my podcast. His name's Dr. Nunnally. If you just look up Evan Brand cavitation, you can listen to the podcast. He says 90 to 95% of people who get teeth removed, they have an infection. Now, maybe he's biased because that's his business, but I bet he's right. I really do.
Well, teeth are certainly a complex issue, and especially when someone comes to see you and they're like, okay, I want a consultation with Dr. Jack Wolfson. I want a consultation with Evan Brand. I want to discuss these issues. And then you're like, and they're expecting to get some information about, hey, what's this magic supplement I can go on? Or, give me some dietary recommendations. And then you're like, here's what you got to do. You got to fly down to Texas. You got to see Stuart Nunnally. You got to spend $5,000 to have the cavitations looked at, or even more to have root canal teeth removed. And it's like, hey, I'm sorry to be breaking the news to you that, your teeth may cost you $10,000, $15,000, $20,000. But I guess what I would say to this, I'm asking your opinion as well, is that when should we reach that? Should we try with people other things first before we dive into the teeth? Or are you at the point right now where no, teeth are so primary of a concern that we need to address that in the beginning?
Man, that's a great question. And I think there's no perfect order of operations. I wish it were sexy to say there's a black or white answer, or say, hey, you got to start teeth first, gut second, liver third, heart fourth, or something. But I don't think it works that way. For me, the biggest health struggles I had came from my gut. I had parasite infections. I had H. pylori, which was reducing my stomach acid, which led to candida overgrowth systemically. I had antibiotics after my wisdom tooth extractions, which destroyed my gut microbiome, which were causing me all sorts of issues like brain fog and fatigue and insomnia and joint pain and anxiety and depression. So I'm kind of biased towards putting the gut first, just because we know about, like, even you and I, we did some great interviews together talking about leaky gut, leaky heart, So I would honestly try to say the gut is number one still. But I would say the teeth are definitely top 5 because, I was taking motherwort. I was taking all these calming adaptogenic herbs to help mitigate the heart palpitations. But that wasn't a deficiency of adaptogenic herbs. That was something that was releasing toxins into the bloodstream that had to be fixed. So yeah, it's great that I did motherwort as opposed to a beta blocker, but I still had to go to the teeth. So I probably wouldn't get focused too much on the order of operations. I would just say whatever you stumble upon in the functional medicine world is probably going to elevate your health to the next level. Like for me, I'd been doing this, this thing for 6 years. I've been figuring stuff out and testing new things, and sauna and infrared this and float tanks and this herb and cannabis and this and that. And then here I am 6 years later, and I'm still working on myself. And now I had this whole new avenue that blasted open a new door for me. So I think it'd be good to turn over the biggest rock first, which is probably the gut. But if you turn over a different rock first, that's okay too.
Well, and when you say really, I guess, fundamentally, it is still about the gut, right? Because the teeth is still in the in the gastrointestinal tract. So I guess we'll put it all together. And obviously there's leaky gut, there's leaky heart, there's leaky teeth. And when those teeth leak bacteria and other toxins into the bloodstream, that's, this is not alternative thinking. This is just reality in the medical literature thousands of times over, that the same bugs that they're finding in the teeth and in the periodontal area and in these abscesses in the teeth are the same ones they're finding in coronary plaque. So it's all over the place. But I do want to say congratulations on the impending baby number 2. Certainly, we've got 3 over here, including a almost 10-month-old, and you're a lot younger than I am. And baby number 3 is born. Journey is her name, and yeah, we had 2 boys and a baby girl. And we did another home birth, our 3rd home birth, and it was really phenomenal. But I'm 47 years old, and I'm staying up. It's 3 o'clock in the morning. I look at my wife. I'm like, oh my God, I'm 47 years old, and I'm changing diapers and all this stuff, and we're back into it. But I wouldn't trade it for the world. It's phenomenal. But I want to say this is that, really how, we talk about the teeth, these issues are all starting, we can say in utero, but certainly when they're young kids. So what kind of recommendations do you have really for these parents that are out there? Like, how do we save the next generation of children from becoming the casualties from the dentist?
Oh man, yeah, great question. I interviewed Stephanie Seneff, which is somebody you should probably have on your show too. We talked all about glyphosate and we look at the glyphosate and autism statistics. Now we're seeing that it's like 1 in 36 now. Just a short time ago, autism was like 1 in 10,000. So, I mean, that was a mind-blowing episode. And, you know, her and Diedrich Klinghardt, who's another guy who speaks a lot about autism and toxins and retroviruses and chemtrails and all sorts of stuff, you know, they both are like, hey, the future generation is pretty much doomed. You know, 20 years from now, every kid's going to be autistic. The population will not survive. You better hurry up and enjoy life now because it's going to come to an end. The USA will collapse. And I'm like, God, that's a heavy message. And I just don't want to believe it. And so what I'm doing is just trying to raise my kids as healthy as I possibly can. I'd say number one is to try to get the mother and the father as healthy as possible before you conceive. You know, I don't really market myself as like a functional medicine fertility guy or like a pediatric functional medicine guy. You know, I just started to help a lot of mothers with fertility issues by accident. You know, I would have these women who say, hey, I've been working with this fertility doctor for 10 years. They can't help me. I'm about to do IVF, but it costs $20,000. I don't have that money. So I'm just going to work with you first to fix my digestive problems. And then we eradicate these parasite and other infections that were messing up their ability to absorb amino acids and create hormones. And guess what? All these women started saying, Evan, I'm pregnant. What do I do? I'm like, oh, crap. Well, let's stop the herbs because we can't use these while pregnant, but congratulations, you're fertile now. And I was like, wow, this is a pretty cool thing. So I would say, you know, get the mother and the father as healthy as possible. I run a test through Great Plains Laboratory called the GPL Tox, TOX, and it looks for all sorts of stuff. It's a urine test. It looks for gasoline. It looks for xylene. It looks for pesticides, organophosphates. It looks for nail polish and hair dye and cosmetics and all sorts of chemicals. And we know that a lot of these chemicals can increase all sorts of autistic spectrum disorders. It can create shorter pregnancies. Some of these chemicals can be linked to miscarriages. Some of these chemicals are linked to birth defects. Some of them are linked to cancers and leukemias. So the goal on a perfect world, pregnancy would be a 5-trimester thing. And the women are like, oh my God, it's long enough. Please don't extend it, Evan. But let me explain why I think it should be 5 trimesters. First trimester is getting the mother healthy. It's detoxing chemicals. It's eradicating parasites. It's getting rid of viruses. It's going organic as much as you can. It's getting the mother to say no to obligations. It's getting her to de-stress. It's getting her to have healthy relationships. It's getting her to bed earlier. It's blocking the blue light. It's cutting off the breaker to the bedroom. It's mitigating EMF. It's getting rid of Wi-Fi. That's first trimester. Then the second trimester is the first trimester when you're growing the baby. Then you have the baby, and then the 5th trimester, you know, 4th, 5th trimester comes in, and that's the gut support. That's the breastfeeding. That's the continuing to stay organic. You know, that's the collagen or the colostrum or whatever you can do to rebuild mom. That's supporting the adrenals because, you know, you see so many women now that get postpartum Hashimoto's where they develop a thyroid condition because of the stress of the pregnancy. It just drained them and depleted them and the immune system's wrecked. So that's kind of my like ideal world. And then I pretty much keep my wife, you know, she's still breastfeeding. Our daughter's going to be 2.5 soon. She's still breastfeeding. We've still got her taking fish oil. We've got the baby doing cod liver oil. We've got my wife on, you know, organic greens. We've got her doing prenatal, high quality multi-nutrient still. So for the kids specifically, I mean, breastfeeding is like the go-to thing because even from a structural perspective, like you were asking about the teeth, you know, how do we save these kids from the dentist? Well, one way is breastfeeding because, and I'm not an expert on this. Maybe you have more to say about this than I do, but I do know based on some limited knowledge that when you're breastfeeding, the sucking mechanism that a child is doing is extending and developing the structure of the jaw so that the kid has enough room in its mouth. I was not breastfed at all. I asked my mom, did you breastfeed me and all? No, I didn't. I'm like, did you try? And I think she said maybe she tried for like a day or 2 or something. So go figure. I had no room in my mouth. I had to get 8 teeth removed because I literally had no room. So if you could breastfeed your kid and prevent them from having to get extractions, therefore preventing cavitations, I mean, that would be like priceless.
You know, Evan, this information is so amazing. I'm blown away by the stuff that you're saying, and I'm in total agreement with everything. You know, for those that out there that are listening and, that are hearing Evan speak, and Evan is not a medical doctor. Evan is not a doctor of chiropractic or naturopathic medicine. Evan's got his credentials and he's got his training, but a lot of this is just, you came out of the school of common sense. And to understand this, I've been up, with some of the smartest doctors, in the United States. The people that I've trained with in Chicago and out in Arizona, and people that were the heads of major programs, Temple University, that were big shots, once again, all over where they came from. And they don't hold a candle to the stuff that you're saying. And the stuff that you're saying is common sense. And yeah, of course, the breastfeeding mechanisms that help to develop the jaw of the mouth of the child, or all these things you said about the first trimester, about getting healthy before you get pregnant. That fundamentally, that is number one, that's how you raise healthy children. So maybe you've already had a cardiovascular event. Maybe you've had congestive heart failure, atrial fibrillation, and you're listening to this. This is a way that you can share with your children and your grandchildren so they don't suffer the same health consequences, yet at the same time, you can really start to recover your own health. I mean, Evan, I can't imagine how many people are listening to this episode that do have palpitations, and here you're someone who's like, I tried everything for my palpitations, and it turned out it was coming from the teeth. So that is just phenomenal type stuff. Tell me when someone, so if someone was to come to you and they do have an issue like hypertension, kind of, they call you up, Evan, great to talk to you. Appreciate you doing a consultation on me. I've got hypertension. What say you?
Yeah. So the first thing is I'm going to come in and give them some nutrients to try to help out. I'm going to give them a Band-Aid, admittedly. Now, my Band-Aid is still going to be far better than the pharmaceutical drug, though, right? I mean, we just saw the massive recall with valsartan in the U.S. with a lot of cancer causing. I don't know if it was multiple cancer causing chemicals or what the deal is, but I just know that the valsartan was recalled, a lot of different manufacturers of it, and it's bad news. My grandfather was taking valsartan for hypertension, and he was having a lot of issues with it. He was having arm pain and weakness and rashes and just crazy stuff. And so, he went to his doctor and he said, are there any other alternatives? Like, is there another way to go about this and not use this drug? And they said, well, we can switch you over to this drug, or we could switch you over to that drug. But ultimately, the answer was never going to be to go for some type of herbs. And that's kind of disappointing. So the first step is, if they're on a blood pressure drug, you got to figure out what drug are they on, because you can give natural remedies for blood pressure and actually lower the blood pressure too much, which is not good. So you got to be careful with that. But generally, I'm going to use a combination of like some vitamin B's and Bravo B6. Magnesium can be helpful. Pomegranate can be helpful. Vanadium is really good. Lipoic acid is good. N-acetylcysteine, believe it or not, I've seen it help blood pressure. Hawthorn extract is really good. You told me about a couple others. I want to say you told me about celery. It was either you or somebody told me about celery being good for hypertension. I actually have used it, and it does work quite well. It just makes you pee a lot. I guess the mechanism is acting as a diuretic. So that's like,
and the other thing, is, celery seed, has efficacy as well. And it's
that's what I meant.
The celery seed.
Yeah.
Let me ask you this. So you're doing all these things, and as a functional medicine practitioner, you are not supposed to stop people's pharmaceuticals. And I'm guessing that in reality is that you don't. So how do you engage with the patient to work, I guess, with their medical doctor to get off the pharmaceuticals, probably simultaneous to what you're doing?
Yeah, that's the $1 million question. And I just say, here's what I tell them. I say, okay, Dr. Wolfson, so you've got this valsartan you're doing. I'm going to add in this formula here. And what I want you to do is I want you to do your blood pressure drug every day like you're supposed to, but now you're going to add in a half dose of this supplement. And I want you to track your blood pressure twice a day, once in the morning, once in the evening. I want you to keep a journal of it. Let's say you were at 150/90, and now all of a sudden with a half dose of the supplement, we've got you down to 135/85. It's like, that's already pretty good. And then let's go to a full dose of the supplement and the drug. Okay, perfect. Now you're at 120 over 80. This is exactly what happened with my grandfather. We got him to 120 over 80, even less. We got him at like 115 over 75. I was super happy.
Mm-hmm.
And now I want you to go to your doctor, and I just want you to tell them that you've addressed your hypertension holistically, and you want to ask them if there's any weaning protocol that they need to follow. And if the doctor says, yes, there's a weaning protocol, I want you to go to every other day, then every third day, then every fourth day, then you follow the weaning protocol. If the doctor doesn't give you a weaning protocol, then you kind of just have to go about it on your own. And I just let them decide of, are they going to do once every other day? Are they going to do a half dose, but it's every day? And a lot of people, their doctor actually does say, wow, I measured your blood pressure. It looks good. Why don't you try every other day for a week or two, and then every third day for a week or two, and then they just stop and they're fine. And that's exactly what happened with my grandfather's doctor. He supported going every other day, then he supported going every third day, and within 3 weeks, he went from being at 150 over 90 on a blood pressure drug to being on a supplement at 118 over 78 off the drug completely, no side effects, and he's fixed. Now, obviously, there's a lot of root cause stuff that he probably needs to do. That guy's got more mercury in his mouth than you would believe. When he opens his mouth, you could almost see your reflection in there. That thing's a mirror when you open that mouth. It's like, God, get that mercury out of there. But he's not, he's not going to do it. He still drinks chocolate milk with high fructose corn syrup in it. We know that fructose is a major driver of hypertension. So if we could just get the fructose out of his diet, we could significantly keep his hypertension down. But you got to work with who you're working with. And as you probably know yourself, your family may not be the people who are going to listen to you, because to them, you're Jack, you're not Dr. Wolfson. So they may not take you as the same, whereas person who's paying you, they're going to listen to everything you say. So if you say, get rid of the corn syrup, they're going to get rid of the corn syrup, where he's like, oh, I love my chocolate milk, Evan, I'm not going to get rid of it. So that's his story and case. But if we were in a client situation, then we would be going into heavy metal testing, because I've seen a huge link between heavy metals and hypertension. We would be going to the gut for sure.
When you talk about heavy metals testing, what are you doing over there?
Yeah, so what I've done, I cannot prescribe with my credentials. I cannot prescribe. And even if I could, I wouldn't, because what I found is a company called BioRay. They have a tincture that's called NDF, like Nancy Dog Frank. And it's actually, they've shown this in their testing, that it's an effective provocation agent, far more effective and safer than your typical DMSA or DMSO, your chelators. You can use this stuff. All it is a micronized chlorella. But the micronization process, it makes it so small that compared to your typical organic, like broken cell wall chlorella, this stuff is like chlorella on steroids. And we're seeing like a 3,000% increase in excretion of metals. So what we do is we have these people, the typical dose is 1 milliliter, which is about 26 drops. We have people do 6 milliliters, which is about 150 drops of the chlorella, and then we collect the urine. And I swear you will be blown away at the excretion of metals just in the urine by using this as a provocation agent. And then that's the tip of the iceberg, right? You're like, okay, look, your pre-challenge was this amount of mercury, your post-provocation was this percent. Okay, you've got a major mercury problem. So then what we do is we just take them back to a baseline dose, and we say, okay, start at 3 drops, work your way up to 52 drops twice a day. And what we're seeing with the labs is we're seeing a 65% reduction in all heavy metals across the board in 6 weeks. Now, some people don't have the budget, or they don't have the interest to do the metal testing. So to be honest with you, that stuff is so safe. We could just throw them directly onto the tincture.
But I like toxic. Data. Yeah, we're also toxic anyways. Let's just go ahead and go straight to the protocol. But I agree with you as well. I like the data as well. And I think the data is motivational to kind of show people, hey, listen, here you were at time 0. Now here we are at time 90. Keep it going. Or if something is awry, we can identify that and change course if need be. I want to circle back, to the valsartan. And when we spoke at The Truth About Cancer, I put up that slide about telmisartan, which is another angiotensin receptor blocker, and the increased risk of cancer in those patients. And that was a trial that, that was a study that looked at 30,000 patients. So the valsartan data, I think it was tainted generic is what it was, but the actual drug itself likely increases cancer risk.
Oh.
And you have to decide, why exactly are you taking a pharmaceutical? We don't get any awards for low blood pressure. We want to decide, is the low blood pressure decreasing my chances of heart attack, stroke, kidney disease, or dying? And it barely does that, and maybe it increases cancer risk. And then I'm sure you saw this from a couple weeks, from last week, how ACE inhibitors are linked to 14% higher risk of lung cancer. And this is a drug that's been around for 30 years, and there's tens of millions of people that take this in the United States alone. And the fact that it increases lung cancer risk, because what's happening is that when you inhibit the ACE enzyme, you have this plethora of bradykinin, which leads to cough from ACE inhibitors, and that all that lands in the lungs and stays in the lungs, and therefore causes, cellular dysfunction and cancer.
What's the most common, what's like some of the brand names of those ACE inhibitors, just in case people are listening and they're like, am I taking that? I don't know if I'm taking that.
Great question. So and a lot of people asked us this on Facebook as well when I posted the video. I was in the, talk about, and what you and I are doing right now, and I know what you do with your podcast, is just getting the information out there to the world to save the generation, so we can prevent this fatalistic thing that Stephanie Seneff, talks about, and others talk about as well, and how we're going down that path. And you and I are at the forefront of trying to prevent people, from doing that. And I say that because, once again, I was in the airport. I was in Salt Lake City Airport over the weekend traveling. I just got on and did a Facebook Live talking about this study and telling people ramipril, captopril, lisinopril, enalapril, all those that end in PRIL, those are the generic names. And then, of course, the brand names, and generic anyways now, so you're probably not going to see too much of it. But once again, highlighting the people. And what you just said, here's what happens. You go to a medical doctor and you get one of the Pril words. You consult with Evan Brand, and he's going to tell you about magnesium. He's going to talk to you about hawthorn. He's going to talk to you about garlic. He's going to talk to you about nitric oxide boosters. He's going to talk to you about stress management. And this is why so many millions of people are opting out of the medical system, and they're looking for guys like Evan Brand to really get to the nuts and bolts. Can you imagine someone, these women that are paying tens of thousands of dollars, $100,000 for fertility treatments, and it turns out that they were, the whole thing was gluten, or the thing was metal toxicity, or they had some kind of biotoxin they're exposed to. The stuff you're talking about, they'll go to a $100,000 fertility expert when they could have gone to you and found out that they're being exposed to benzene, and factor leading to it.
Well, here's the thing too, is, my wife, kind of a friend of a friend that we watched go through the fertility treatment. This girl was injecting herself with, I don't know what. I'm not a fertility expert in terms of the conventional pharmaceutical stuff. I don't know what it is. I don't know what's in it. Is there thimerosal? I don't even know what's in this stuff, but I just know that this lady, one of her cute pictures that she posted on Facebook after she had the child was the child. And it was like 1,000 needles that she had circled around the kid with a heart shape, and was like, these are all the needles and drugs that led to this baby. I'm so grateful. I'm like, look, I'm glad she had a baby. But what was in those 1,000, we'll call it fertility vaccine or whatever you took? I've got no idea what that was. But when I saw that picture, I got like the chills. I was like, whoa, that's the conventional model versus this model. That was scary.
It is scary. Absolutely scary. But I think, listen, as you agree, the health revolution is on. The time for change is on. We're doing some amazing things. I know if you reach out to Evan Brand, you go to his website, evanbrand.com, and you're going to just get some fantastic information. You better book up your spot with Evan Brand pretty soon, is my guess, because he's kind of all over the place. He's got so many things, obviously so many people calling on him for his health expertise, as you've just heard over the last, 30 minutes or so. And plus, Evan, with baby number 2 coming around, I'm going to think you're going to be even less available for getting your message out there and for individual consultation, right?
I don't know what the plan is. For our first daughter, I think I took maybe 2 weeks off. and I was so ready to get back to work. The good news is I work from home, right? So as you know, it's kind of different when you work from home because it's like I could do a call with you and then run downstairs and go play with my daughter and then run back upstairs to do another call. So I'm kind of blessed in that sense. So I'll probably still work 3 days a week, but I did train a girl, for the last 2 years to do a lot of what I do. So I think that is smart to try to clone myself a little bit because I'm just one guy, and look, I'm not the only guy out there. I don't ever want to claim to be like the all-knowing. I'll just say I figured out enough stuff to help a lot of people, and so if I can try to replicate that, I'm working on a functional medicine course right now. I'm going to unveil that to certain practitioners with certain credentials. That way I can just have other people doing what I do. Because if I can help like 10 people in a day, that's pretty good. But like, what if I could train 100 people to help 10 people a day? That's going to be way better because what we're doing here is not rocket science. It can get complex and complicated, but if you work on the body systems and you get the proper testing and you go through the proper order of operations, you can have a pretty sustainable, consistent success rate with people, far better than what you're going to get if we just threw you on drugs. And I just want to say thank you for our friendship, and I'm so glad to be a colleague of yours. You've taught me so much great stuff over the past several years of our relationship together, like even just the beet powder. You blew my mind last time we talked. You were talking about how much beet powder can do for nitric oxide production and all that. It's like, wow. And here I am thinking I'm just helping someone's gallbladder, but really I'm helping this too. It's like, so I hope that the benefit for our relationship is mutual because I learned so much from you every time we talk.
No, for sure. It kind of circles back to the fertility thing again, is that what they found that a lot of women with infertility issues, they have very low levels of nitric oxide. So you boost up their nitric oxide while they're trying to get pregnant, before they're trying to get pregnant. And obviously it stands to reason is that you have to have blood flow going to the uterus, to the ovaries, to the developing fetus and the placenta as time goes on. And if you're deficient in nitric oxide, that is not going to happen. But pleasure to speak with you, my friend. Stay in touch. Keep us updated on baby number 2. Wish the best to your wife. And thanks again for being on the Healthy Heart Show.
Thank you, Dr. Wolfson. It's a pleasure.
This is Dr. Jack Wolfson, board-certified cardiologist, with another episode of the Healthy Heart Show. We appreciate you staying tuned, and we'll see you next time.